Good afternoon, everyone. It is Wednesday, I think. There's no time anymore in COVID-19 land, but that is okay. We are here with Dr. Mike today, and we're going to talk a little bit about chiropractic health, spinal health, and how taking care of your body is going to basically help you in every part of your life. So without further ado, I'm going to bring Dr. Mike in, and we're going to find out a little bit more about chiropractic. Hey, Dr. Mike, how are you doing today?
Hey, Celia. Nice to see you. Thanks for having me on today.
No problem. I feel like it's been 500 years since I've seen you, even though I saw you get an adjustment fairly recently.
Yeah. I know time is weird right now.
I know.
It's moving slowly and fast. It's just a very weird concept, isn't it?
I feel like I get up, I do my live stream, and then it's 7 o'clock at night.
Yeah.
But it's not actually 7 o'clock at night.
Like Groundhog Day.
I know, except I don't see Bill Murray anywhere. So, I mean, I guess I'm doing it wrong. So, Dr. Mike, tell everyone a little bit about yourself and your background in chiropractic.
Okay. Well, actually, it's interesting. I have an interesting story, and I think it's kind of appropriate for what we're experiencing in these times right now. But it actually started when I was a young boy, and my mom used to go to a chiropractor because she had a back injury when she was in high school. And so, as a young boy, around 6, 7 years old, I would follow her to the chiropractic office that she'd go to, and I would just sit there in the waiting room and I'd look at charts like this on the wall. It always intrigued me to see these nerve system charts and to see people coming in and people coming out and going out. And lots of people in there, and I didn't really get it. I wasn't really sure, but I knew he was a doctor of some sort. Anyway, fast forward a little bit later than that, I was actually 7. Came down with a really, really nasty infection. Excuse me. And I had headache, I had fever, joint pains, I was vomiting. It was awful. And it was a nasty strep infection that lasted for a long time. I was basically out of school for a week. And I wasn't responding to any of the medication, any of the over-the-counter drugs. And I had gone to the pediatrician, and he just threw his hands up in the air and he looked at my mom and he goes, Mrs. Shrednowski, I don't know what to tell you. I don't know why Mike's not responding to this medication. Maybe you can try a different drug. And he wrote a different prescription out. And long story short, we walked out of there, and I said to my mom, I said, take me to that doctor that you go to for your back. And she goes, why? And I said, just take me to him because he's a different type of doctor. Maybe he has a different opinion. Maybe he can say something different. She thought I was nuts, being that I was 7 years old. And I used to watch all those surgery TV shows and watch them do it on TV as they're doing surgery. And she's like, we were weird as a kid. We used to watch that stuff. And so I was always intrigued by it. She went and she took me. She took me to the chiropractor she had gone to. And he didn't really say much. He just had me come in. He said, lay on the table. He checked my spine, adjusted me. And I didn't know what hit me. I just knew that the room looked like it was spinning, and then I was sitting there in almost like a semi-comatose state, like what just happened to me. And after we left, we went home, and it was within that same hour that my fever, everything started to break. I started to feel better. I didn't have the head pain, the headaches. All my symptoms started to change, start going away. And I said, this is crazy, but anytime I feel so much better. Anytime I get sick, take me to that doctor first. And then when we went back, and my mother asked him, how did this work? What happened? He just said, hey, listen, your body functions better when your spine is in alignment because your nerve system is clear. She goes, well, how often do we need to come? He goes, just come once a week for regular wellness and just stay healthy. It's better to stay healthy than it is to get healthy. And that was my story. So we started getting chiropractic care at that point when I was 7 years old. Now I'm 48. So for 41 years, I've been getting adjusted. And it's been really cool, very cool experience, personal experiences that I've had with chiropractic care. And then it was, sometime when I was in college, I was in first year of college. I was into the sciences, but I wasn't really sure what I was going to do. And my mom called me up and she goes, I saw, we had moved, we went to another chiropractor. And she goes, I was at that doctor's office and I saw he has a pamphlet for chiropractic college and it looks pretty interesting. You interested? And I said, sure. She goes, you want to go? I said, where is it? She goes, it's in Marietta, Georgia. And I was upstate in New York at the time, and it was cold. So I said, Georgia, sounds good. Let's go. And that was it. and I drove down, checked it out, went to chiropractic school down there, and graduated when I was 23 with my doctorate. So there you go.
And where are you practicing right now?
And now we are in Kings Park, New York.
Right over by the train station. Very easy to find.
Yeah, just between Main Street and the train station.
Yes. I actually met Dr. Mike because I was doing a video for his practice, and I was like, hey, my neck hurts all the time, and I get headaches, and my back hurts from carrying all my gear, this and that. And you were like, have you ever considered like chiropractic? And I was like, I mean, I probably should.
Yeah.
And look at us a couple years later now. I feel like it was probably 2 years ago, probably.
Yeah.
At that time. And it definitely has changed my life. So I wanted to make sure that I brought you on to talk to all of our viewers.
Yeah, definitely cool. Yeah, I remember that day when you were filming too. That was a good video.
It was a good video, and we had a lot of good testimonials that day too, which made me want to work with you more because everyone had such wonderful things to say.
Yeah, and it's kind of interesting these days and these times, with essential workers. The governor has outlined what's essential, what's not essential. I mean, everybody is essential, but when you think about the governor's outline of what qualifies as a business that's allowed to stay open and run, he obviously values chiropractic healthcare because we are considered essential healthcare practitioners at the moment. And we still have patients coming in. We still have practice members coming in. Obviously, there are certain parameters because things have changed, and we mitigate those things as we go. And we have everything in place as far as triaging patients before they come in. But the interesting part is that most of my practice is consists of essential workers. So it's kind of funny. I feel honored to be open because we're essential for the essentials. You know what I mean? Does that make sense? But to keep everybody else functioning and working, I think my best contribution is to be able to be there for them and make sure that they're free of stress, that they're free of any kind of spinal issues, free of pain, obviously, and that they can continue to do what they need to do so that everybody else can have what they need to have for their bare essentials, to keep going in this tough time. So I feel very blessed for that.
And I know everyone has really appreciated you being open. I stopped in because I obviously have neck problems, and you can just tell by the people who are either waiting or leaving very quickly before or after me that everyone appreciates the fact that they're still able to take care of their spine. I know, for instance, I get headaches. I know other people have other problems. But being home and being on the couch and watching TV or sitting in bed where you're looking like towards the TV on an angle.
Or looking at computer screens when we're talking with doing lots of Zooms now, everybody's looking at computer screens. Yeah.
Yeah, even right now, I'm looking up at a camera, but if I was doing the entire thing looking down this way, that's really affecting my posture.
Yeah, same. Yeah. And it's interesting though, because just from my perspective, being on the inside, and this goes, this is kind of a tough thing to communicate, but I'll say it like this, is that, and many people might not understand it, but I'm so proud of the people that are coming in here because they really, truly, honestly get it. And when I say get it, it's getting the big idea. There's a big idea in chiropractic, and it's really the underlying philosophy of why we do what we do. And it all starts with the very, very first adjustment. Do you have time for me to elaborate on that real quick?
We're not a TV show. We could be on as long as.
All right, there you go. I just didn't want to, Okay. Anyway, so it all starts with the first adjustment. And the interesting thing is that most people aren't even aware what the first adjustment is. Back in the late 1800s, there was a doctor named Dr. D.D. Palmer. And Palmer was a very creative guy. He lived in Iowa, in the Midwest, okay? And it was very difficult for them to get iodine to the Midwest. And usually get iodine from fresh fish. So he was a fishmonger for the Midwest because he found a way that the people had health issues because they weren't getting enough iodine in their diet. So he found a way to get fresh fish from the coast into the Midwest. And then as a thinker and as a healthcare practitioner of sorts, back in those days, the lines were very blurry. He dabbled in magnetic healing too. And so he put all these things together, and then he had these charts, like this nerve system chart that you see back here. And he studied the nerve system, and there was one point in time where there was a janitor that worked, or a custodian, at those days, a janitor, in his building. And the janitor was deaf, and he communicated with him, and he got the information from his janitor that his deafness occurred when he bent over in a stoop position and lifted a box, and he heard a pop in his spine, and he lost his hearing. And so Palmer just reasoned. He was a very reasonable guy, smart guy, a thinker, and he thought, and he goes, hey, you know something? I've been studying this nervous system. It's really closely related to the bones. And maybe if you heard a pop, maybe one of those bones just misaligned enough where it's causing pressure on the nerve. And that could be the cause of why you can't hear. I mean, it makes sense, right? So he reasoned with Harvey Lillard, the janitor, and he felt his spine, he felt the bone out of alignment. And as it's written in the text in the 1800s, he racked it back into position. And then a couple of days later, Lillard got his hearing back. So it's a really cool story, and it's the spark of the first true chiropractic adjustment. There have been records of spinal manipulations for hundreds, even thousands of years before that, even back to the Egyptian times. But the true first spark of chiropractic was that adjustment in the late 1890s. And that was Harvey Lillard getting his hearing back. So it had nothing to do with back pain, right? So getting the big idea. What is that? I'm glad you asked. The big idea is the fact that your body has the ability to heal itself. It doesn't need any help. It just needs no interference. And when you have to look, when you break it down and break it down and break it down, you say, all right, well, if there's interference to the healing mechanism, then you have to investigate, well, what's the healing mechanism? You know, if it's just the circulatory system, then we don't know, because if something was lacking blood, you know, you could say that particular thing won't get life to it, but it wasn't necessarily blood that created the information, or that's responsible for the information that comes out of each and every cell. It's nerve system, nerve supply. So the brain actually has to control things. You need blood to keep the oxygen and the nutrients circulating, but it's not the blood that's in control of your cells, it's the nerve, right? So then we just extrapolate more on that. You say, hey, if your nerve system is responsible for keeping you healthy, then what happens if you have pressure in your nerve system? What happens if you have some kind of a deficit in a nerve, and that nerve goes to a vital organ? Will that organ be at 100% or at less than 100%? And then you say, well, yeah, gosh, it would be less than 100%. Okay, all right. So the next question is, where could that nerve be interfered with? You know, where would you find interference in a nerve? How does that work? If you trace the nerves back, they all come from the spine, and the spine is hard bone, and it has exit points for every single nerve. I'll show you. This is our trusty spine model, but you can see that these are the nerves that come out of the spine, and then they come out from little tiny holes between the vertebrae, and those holes are separated by soft discs. Everybody knows what like a herniated disc is, or they've heard of disc injuries. Those are the cushions between the vertebrae, these cartilage cushions. So literally, if you have bony misalignment or irritation on the nerve root, then that can cause a problem at the end organ, whatever that nerve goes to. So that's what Palmer realized. He said, hey, listen, we got this bony thing that's protecting our central nervous system. And something out of alignment, no good. Got to put it back into alignment. Now, I don't do the healing, but when we put things back into alignment, we open the floodgates. It's kind of like taking a kink out of the hose. You know, you try to water your grass if you have a problem or a break in the sprinkler line or a kink in the hose. Water ain't coming out. And so the grass does what? Turns brown, right? So that's literally how simple it can be with chiropractic care. So then that's it. So the big idea is that the body heals itself. We just have to remove the interference.
That's really interesting. I'm sitting here just like, well, that makes a lot of sense, and this connects to this.
That's the problem. It makes too much sense.
People don't like simple.
People expect me. Look, Dr. Mike. Okay, so I have the doctor in front of my name. What does that mean? Really, back to the root of the word doctor means teacher, and it's just a matter of explaining these things. It just made sense to me. I was a patient. Made sense. So you have to go through school to get the piece of paper that says doctor, and now all of a sudden you're an expert. But it's not. It's just I know the same thing that I just told you. It's like that's it. It's just how to do it as a profession. That's what you need a doctor for. How to run a business.
So I know you mentioned, like, for instance, the hearing in that story. Yeah. What other types of things, like, have you seen over the years come back or affected? I know obviously something with my neck, like that was the nerves within the neck, but you're basically saying that it's not just spinal, like, pain that you're working on. You're working on the whole body, correct?
Essentially, yeah, that's right. And that's the thing. It gets the lines can get blurred really easy when you have something, when you have a testimonial of a patient who, let's say, they were infertile and then now they can have a baby and they can have a kid. Or if you say a person had severe digestive trouble and they were on tons of medication and now they're on no medication, they have no digestive trouble. So what I mean by blurred is that chiropractic is not a treatment for those things. So for me to even claim that I treated those things and helped those things is really inappropriate. All I do is I remove the interference in the central nervous system at the spinal level. Remove the subluxation. The subluxation is the name that is given to that condition where the vertebrae are either not moving right, they're either stuck, they're locked up, they're jammed, or they're just totally irritating the nerve in that area. You remove the subluxation and the power that made the body, it's what heals the body. It's kind of like this, talk about nutrition, right? So nutritionists will give you advice and they'll say, hey, you need these vitamins, and they say you find them in these foods, and then go eat them. But the nutritionist doesn't do anything for you as far as digesting the food, breaking down the nutrients, assimilating the nutrients, and rebuilding up human tissue. That's all done inside the body, and that's called innate intelligence. So, when it comes to the things and the miracles that we have seen here in chiropractic, I mean, there's so many, and there's probably more that people don't even tell you. We do a great job, obviously, with things like pain. Okay, neck pain, back pain, mid-back pain, headaches. A lot of people have pain. A lot of people get better. Some people don't feel better right away. Some people don't feel better at all. Sometimes it happens. And it's not necessarily because it's not a chiropractic issue. It's just that there might be other things going on. We could remove the interference to your spine. You might still have a symptom. That means that it's not a chiropractic issue, or at least, and I was explaining this today. I don't know if this is, it's too heavy or not, but I was explaining this today to somebody because she came in, she feels great. She's gotten really good results so far with lots of things, but she continues to have this particular pain in the mid back, and it's right over the right shoulder blade here. So I checked the spine and everything's moving good. It doesn't seem subluxated. There's not like a chiropractic finding there. So I'm thinking to myself, why isn't she healing? Why isn't she healing? Why isn't she healing? What's happening? So then we have to think about the organs inside, and there might be some kind of organ dysfunction that's going on that's already happened, but now it's gotten to a point where it's too late, where that organ has gotten to a bit of dysfunction so much that no matter how much we clear the nerve, it's going to take too long, or maybe it won't heal yet at this point. It might need some other intervention. So we made some suggestions for her to look into that in addition to what she's doing now. So in that case, some people could be watching this and say, oh, I went to a chiropractor, it didn't work. What works is if you had nerve interference, you get it corrected and cleared, then it worked. The result is different for everybody. Does that make sense?
Yeah, that totally makes sense. And also, it's not a one and done thing. Like, right. It's not like you're going to walk in there and then all of a sudden, oh, I'm all done.
Good
like
point.
You need to follow up, and you need to continue to go because
right.
your nerves will get blocked up again.
Right. So, okay. So that's good. So I didn't want to divert too much from your question before, but there are lots of different miracles that happen. A miracle could be something as a mom can't pick up her kids, and then she has little toddlers, and then she gets adjusted and she feels so good. Now she can pick up her kids. A miracle might be for somebody who loses 30 or 40 pounds now because they can exercise where they couldn't exercise before. And that might save them from a heart attack. You don't know how the extent of what the miracles are. Some miracles are, this happened a long time ago where a baby, a mom had just delivered a baby and the baby wasn't latching on to breastfeed. And she really wanted the baby to latch on to breastfeed. So she brought her in, she was a day old and she got adjusted. She did have a subluxation and then she latched on like right after. So is it chiropractic that caused the baby to latch on? No. Is it chiropractic that removed the blockage for her innate intelligence to function better? Yes. So as far as how often you should go, how much you need, that all depends on your level of breakdown. People come in at different ages. They come in at different levels of breakdown. We look at stages of degeneration. Some people have different occupations. The first thing I know you're thinking about this, Celia. I know you're thinking about this. The question is
the scary thing you showed me when I was there about the
no. You're going to say, well, what age should you get a chiropractic adjustment at? Who's it good for?
All of them.
From the womb to the tomb. That's what we say, right? From the womb to the tomb. As long as you're alive, and if you have a spine, then you have the potential for a vertebral subluxation. The next question I know you're going to ask is going to be,
Dr. Mike?
well, Dr. Mike, how do you get a subluxation? How does it happen? Right?
How?
Okay.
Go for it.
So this might be more important now more than ever to understand this. The cause of subluxation or vertebral misalignment and interference at the nerve system, the cause comes from stress, chemical, physical, and mental emotional stress. Okay? Or we say thoughts, traumas, and toxins. Right? Stress causes these problems. Stress is a huge problem, especially emotional stress. Right? We see physical stress with falls, injuries, accidents. We see chemical stress with obviously too much. Things you have to do things in moderation, but some people take too much medication, way too much medication, or they take a medication to counteract the effect of another medication, and then this snowball goes on. And then obviously, you say, well, medication made you healthier, and the people on the most medication would be the healthiest. And we know that's not true. So sometimes that could be a chemical stress, smoking, drugs, alcohol, whatever that is, chemical stress, environmental toxins where you might work if you're in a processing plant and you're working with chemicals in there. They had these people that were, they coined the phrase popcorn lung because people that were working in the microwave popcorn industry, there were chemicals that they were putting in the microwave popcorn, and they were finding when they were inhaling it, it was blowing out their lungs. And that's why the people who are vaping tend to have that there was some research that was done on that because the same chemical was in that vape. So there's chemical stress and then the mental emotional stress, that component. And stress can happen from the birth process. When you're a baby and you're born, you're going from this, the womb is a warm and it's a dark and it's a moist environment. And then you get popped out into a cold, bright, and a dry environment. That's just very stressful, getting squeezed out. And then that's the natural childbirth. Imagine if you had a medical intervention there and you had to have that where they either do a C-section or you're a breech baby. And there's lots of different stressors that can occur at the birth process. So it's really important to check people's spine at that age. Were you thinking also about the other thing, right? Like how often you need to come?
Yeah, I alluded to that because I mentioned you can't just go once. It's not going to work if you go once, because if you go once, and I'm speaking as just someone that obviously has learned about this for a couple of years. If you go once, you're going to get fixed. But what happens when you lift that heavy box, or what happens when you turn the wrong way while you're driving?
Right.
You obviously have to make it into more so a regular practice.
Right. So it's kind of like the best analogy is like going to the gym or exercise. Okay. Like, you know that if you're going to go to the gym, you can't go once every while and expect to get physically fit. If you only go to the gym when you feel fat, it ain't going to work. So people only go to the chiropractor when they have pain. Really doesn't work that great. Yeah, you could get one adjustment and feel amazing, but did it do anything to correct the problems in your spine? And that's why we do an x-ray. So I can find a problem on the exam. Person lays on the table, we check their spine with our hands, and with the analysis that we can do, we can find a subluxation. Sorry, hold on a second. We can find a subluxation. I know. I don't know why I turned the ringer down.
Well, we also have someone that said hi, Dr. Mike, on the stream. So
hey, who was it? I don't know who it was.
Robert Freeze.
Hey, what's up, Rob?
All right. Sorry, didn't cut you off, but
no, okay. Dr. Mike. Okay, sorry. I tried to silence that before we started, but it's okay.
It's all good.
Okay, so yeah, going to the gym. Okay, so you got to do things regularly. Look, there's an irrefutable law. Okay, it's a law that you can't argue. All right, people can complain about things, but they only complain about things when they can be changed, right? But you don't hear anybody complain about the law of gravity, do they? I mean, you don't see people who are hunched over and who are arthritic going, oh, dang it, gravity. I can't stand gravity. Gravity is something that is a stress on us all the time, right? And it's a good stress and a not so good stress. So the fact is that the law of gravity exists no matter what, okay? And the reason I bring that up is because the law of healing exists no matter what. The problem is that we don't always distribute the healing energy in our body at 100%. Does that make sense?
It does. And we actually got a question that might tie in with this. Lawrence wants to know, how do you feel about getting adjusted for relaxation? And I mean, if you're talking about relaxation as the opposite of stress,
yeah.
That's more so where you're kind of going with this, because if you have that stress, you obviously want to relax those nerves so that it's not a pain or a problem.
Yeah. No, it's a good question. When we talk about relaxation, the thing is, when there's tension in the body, stress causes people to be in a fight or flight response. And we're not really designed to sustain a fight or flight response. And that fight or flight is adrenaline pumping through your veins, right? And adrenaline is good for short bursts. It helps you get things done, helps you get work done, helps you escape danger. But the problem is that when we're in a constant mode of stress, we constantly have adrenaline pumping through our body. It does really bad things to the cardiovascular system, and it does really bad things for your health in general. And you get tension in your muscles. So one thing that has been actually scientifically proven is that chiropractic adjustments can help reduce your stress level, because when you're balancing out your nerve system, you're balancing out. It's gonna work. What's that? I thought somebody said something that was interesting. When you balance out your nerve system, you're able to balance out your body chemistry as well too, because everything functions normally without interference. And then muscles can relax, even if it's a physical injury. Let's say somebody, they bent over, they hurt the back, and then they have a pulled muscle in their back. Now the muscle gets tight and pulled because it might be damage to the muscle. But what happens is the muscle attaches to the vertebrae. The vertebrae will get racked out of alignment, and that'll cause more of a nerve impingement, which causes more of a muscle contraction, and it's a vicious cycle. All right. So on a physical level, to break that cycle, the adjustment helps take the interference off the nerve. The muscle can relax. It doesn't have the same need. It's kind of like if somebody broke a bone, they would have splinting. Let's say you broke your forearm. The muscles they splint. They get really tight, and they try to hold. It's innate. Your body's innate response is to hold that bone in place if it's really fractured badly. But it makes it difficult for the surgeons or for the doctors to set the bone because the muscles get really tight. But once you put things in place, then the muscles can relax. So it's a similar concept. So on an emotional stress level, getting adjusted helps to balance your body chemistry, and your body doesn't have to hold on to that tension, or it doesn't have to be in that fight or flight response. That's called the sympathetic nerve system. And we want to function more from our parasympathetic nerve system. If you look on that chart, if you can see down here, there's a green nerve down there. They labeled it green, and at the very top, there's also a green nerve that comes out right at the top there and goes all the way to the organs. And then there's yellow nerves that come from the middle. So there's balance. You have sympathetic, which fires things up. You have parasympathetic, which closes and calms things down. And you have to maintain a balance of these nerve systems. When you're in fight or flight, your sympathetics are just blasted. And people, there's different ways that you can check for that too, for emotional stress levels, by looking at the pupils and so forth. But yeah, for relaxation, just ask anybody who gets adjusted. They love getting adjusted because they feel relaxed.
Yeah, and then we actually had someone come on yesterday who also mentioned that breathing exercises help for the fight or flight to kind of be subsidized as well.
Totally.
So if you guys want to see that, you guys can hop on yesterday's episode. We actually sat there and she counted us through breathing exercises. Which
you want to do something cool about breathing in chiropractic, right?
Mm-hmm.
Check this out. So when I was a student in chiropractic school, I went to a seminar, and it was a seminar by a doc who specializes in what he calls sacro-occipital, or people might know it as cranial sacral technique. And cranial meaning the head, and sacrum meaning the base, the tail, not quite the tailbone, but the sacrum is between the pelvic bones. And one of the things he did, he was talking about when you're looking at the spine, inside the spine, there's the spinal cord, but the spinal cord is wrapped with a nerve layer called meninges. People have heard meningitis. So the meninges are the wrappings, protective wrappings of the spinal cord. And between the meninges and the spinal cord, there's fluid in there. It's called cerebrospinal fluid. And that fluid needs to flow up and down the spine to give the spinal nerve roots nutrients. The fluid is created in the brain, and it trickles down by gravity. And then when we walk, our sacrum, this is the sacrum, and it's kind of hard to simulate on this plastic model, but it literally goes in a figure-8 pattern when we walk, okay? Because our pelvis is designed that way for this to work. And it's literally like a pump. They call it the sacral pump. And what happens as a result of you walking normally and breathing, even deep breathing, helps to activate this sacral pump that forces the cerebrospinal fluid back up the spine. And when we were at this seminar, it was really cool. He had what they call video fluoroscopy. It's when you see like a live motion x-ray. And you could literally see a patient was laying on the table and they had the x-ray on top. And you could see every time they took a deep breath in, their cerebrospinal fluid, because they put like a radio, what do you call it, a radiopaque marker, a tracer in the cerebrospinal fluid. You could see the fluid only come down to a certain spot, and then it would stop. That indicates that these nerves aren't getting the nutrition that they need. So then when he did certain techniques to the pelvis with blocks and with wedges, just to kind of realign things and use gravity as the adjustment, then you can see after the patient started doing these deep breaths that the cerebrospinal fluid was then continuing. Every breath would go lower and lower and lower, and then you could see it totally restored. The function was totally restored. It's the coolest thing I ever saw.
Yeah, that's really interesting because like you don't really think about that. Like when you're thinking about like walking around and you're thinking about your day to day, you're not thinking about how execution is affecting your body. Like I know right now, like I should be sitting a little bit taller. I should be doing small little things to change what I'm doing.
Yeah.
But like the average person isn't thinking that. The average person isn't saying like, oh, I need to fix my posture because they're like, oh, my posture's bad, but they don't have that because.
Yeah, it's a great thought, because when we think, a lot of people come in and say, oh, my posture's bad. I have bad posture. I'm like, all right, so fix it. So it's really hard to fix your posture when your spine doesn't move right. So what happens is a person wants to fix their posture. They know that they need to have good posture. Your spine is supposed to be shaped a certain way. On the front view, it should be nice and straight. And on the side view, you should have these curves. Curve in your neck, curve in your mid-back, curve in your lower back. There you go, like this, okay? So there's curves on the side view. But when you're talking about posture, so many people will sit up straight and they'll say, my back just hurts when I sit up straight. And that's because their spine mechanics are off. They have subluxation. The bones aren't moving right. And then they're trying to force a movement or a posture that is just not comfortable. Once they start getting chiropractic care and they start getting adjusted, and then those joints are moving better and you have better mechanics in your spine just on the physical level, posture is so much easier to maintain. And then we look at the x-ray, which can show, I can't tell you how many people have degeneration in their spine, especially in their neck. And degeneration meaning like bone changes on x-ray, thinning of the discs, loss of curves. Then you got to do a certain amount of what they call spinal hygiene to remold proper curves, because your spinal cord is inside there and it's being protected by your spine. when the spine gets that bad, then it winds up putting so much pressure on the spinal cord that's causing damage. Like your body is literally damaging your nerves as opposed to protecting them.
Yeah, that was one of the problems that I more so have. I have no problem talking about my spinal issues on this live stream. It's my live stream, your live stream. So I'm totally cool with it. But when we took my X-ray, we saw that I was not in a like the A-OK stage.
Right.
And like you showed me what it could be if it went to like the really bad stage. So we were I would say pretty not aggressive, but like I was there 3 times a week to work on this.
Yeah.
And
or like going to the gym, like you have to do it regular to get the results that your body needs. Yeah.
Exactly. It went from 3 times a week for like months to fix it, to stop my headaches, to stop my pain. And now I'm coming to you once a week to maintain, so I don't have that degeneration, if I can say the word correctly.
Yep. Yeah, that's it. Everybody needs a certain amount of care. Well, everybody who's subluxated will need a certain level of care, depending on what they present with. And then they also have these things called limitations of matter, and that's one of the things that I was trying to get to with the gallbladder thing. Limitations of matter are, look, I can adjust you till the cows come home, and give you the best adjustment. I can be the best chiropractor in the world. Oh, it's great. But listen, if you're missing a body part, it ain't going to heal. That's like simple. Or if you have a really serious degenerative condition, there's only so much that you can do to get better. Hopefully we would have started, doing preventative measures earlier in life so that it didn't get that way. But you can never really tell. It's not ever too late to get chiropractic care. It just means that your level of healing depends on the level of breakdown that you start with. Does that make sense?
It does. And I know, as someone that had to kind of take that step back to move forward with my spinal health, I've definitely made a ton of Instagram posts about you need to do preventative health instead of health, like fixing your health after. And that's kind of also how like the industry, like the whole medical industry is right now. It's putting band-aids on something you waited too long to fix, because if you intervened earlier and made sure that you were taking care of this symptom, this small problem that might turn into a big problem, it could have been like not a problem at all, if that makes sense.
Something we were talking about earlier, I just want to make sure that we mentioned is that fear. And you were talking about how the medical profession, the way that they treat. I'm not going to talk about the medical profession necessarily. I want to talk about the chiropractic profession.
Okay.
And the thing that I feel like is the main contributing reason for why my practice members still value chiropractic care, even in these times, is because the fact that when I said they get it, it's that they don't have the same level of fear. And I'm not speaking for everybody, but I'm just saying that the majority of people, they've expressed to me that they don't have the same level of fear. And the fear comes from the unknown. And I think the biggest thing that freaks people out right now is this fear of an invisible enemy out there that's marching down the street and it's going to come get you. And once it gets you, you're going to die. And it's not the case. Now, we've lost a lot of people from this, and that's not necessarily, what I'm saying is that, there are people that have gotten this and have gotten better. And there are people that just don't get it and probably won't get it. So how do you attribute for that? How do you attribute that? What's the reason why we haven't all been consumed yet? And even in the past, with any other virus or bacteria for that matter too, is that the one thing that constantly fights day in and day out, whether you have a mask on or not, the thing that fights, that keeps you healthy, is your immune system on the inside. It's your body. It's your immunity. And everybody's immune system can fluctuate. Some can have good immune systems. Some people can have poor immune systems. Who knows? Only you know about your own immune system. But that's the one thing to understand. So we have to focus on, number one, building our immune system up, keeping ourselves healthy. There's so much good information out there as far as what you can do at home to build your immune system up. From supplements to mitigating stress, to relaxing, to drinking more water, to decreasing the garbage, the crappy foods that people are eating. It's really easy to eat poorly because we're sitting around watching TV and there's nothing going on. So people just want to eat. They get bored, want to eat. It's really easy to do that. It's really easy to be sedentary. And now it's even easier to not exercise because they closed all the gyms. But you got to find ways around that. But you got to move your body. You got to get good sleep. Don't stay up until 4 or 5 o'clock in the morning watching TV. I mean, there's so many things you can do. One of the best things that you can do is also make sure that your nerve system is functioning properly. Because what controls all the other systems in your body? What controls your cardiovascular system? What controls your digestive system? What controls your reproductive system, your excretory system, your integumentary system, your lymphatic system? You name it, system. What controls? What's the one that controls all of those, Celia? What do you think that one system is?
The nervous system?
There you go. The nervous system, right.
Oh, listen.
And the interesting thing is about that, your central nervous system is your brain and spinal cord, right? And it's the only organ that's entirely encased in bone. That's how important it is. That's your body has created hierarchy of importance by showing you what's protected by bone and what's not. When you work from that center, the brain and the spinal cord, protected by the skull and the spine, that's your central nervous system. And then you talk about heart and lungs. Those are protected by ribs, but they're not entirely encased necessarily. And then you get lower on, and then you think about the problems that people have in those systems and the seriousness of life-threatening issues in those systems. And it decreases as you get away from being protected by bone. It's kind of weird how we innately are designed that way. But you want to make sure you protect your nerve system. And that means, if you have subluxations in your spine from stress, if you're totally stressed out, and you want to make sure that you're functioning at your optimum, that's what chiropractic is really about. It's not just about the pain.
Yeah, and I know that one of the biggest, I'm going to say stigmas that I hear from people are, oh, it's not so bad. Like, I don't have to go. It's not so bad. And I've even heard that from family members. And I'm like, oh, I've been going and doing this and my headache stopped and this and that. And the answer is, oh, it's not so bad. I don't have to worry about it right now. I'll go when it's a problem.
Great subject to bring up. It was really great because that leads to how you judge your health. First of all, if you want to look at the Dorland's Medical Dictionary definition of health, it's a state. Health is a state of optimal physical, social, and mental well-being, not merely the absence of disease or infirmity, not merely the absence of symptoms. So, when you think just on that point that you just made, when you think about how you judge your health, people will say, well, I feel fine. I feel great. I've got to be healthy. And then you ask, okay, well, how many people do you know that may have felt great and then the next day had a heart attack or have heart disease and they didn't know it until they got something checked at their doctor and they were told? Or maybe somebody who had, God forbid, somebody who had cancer and they didn't feel it. Or somebody who has diabetes and they never knew it. You don't feel those things. So judging your health by how you feel is not necessarily the best way to judge your health. You got to judge it by how you're functioning. And you could do lots of things to check how you're functioning. One of the best ways is to have your nerve system checked because that's your fuse box, right? That's the central core. Everything else comes out from there. So rather than looking at all the organs as pieces and treating the pieces, we look at the central nerve system and make sure there's no interference there, allowing that flow to come out those nerves into those organs at 100%. And that way you're assuring yourself better health because you can't judge by how you feel. You could feel terrible and be very healthy. You could eat some bad sushi and then get sick to your stomach and throw it up. And, I got food poisoning. Oh my gosh, I'm throwing up. I'm so sick. It's actually an expression of health. Or one of the most common things that people misconstrue is that when they get a fever, they go, I'm really sick. Well, you might be fighting something off, you're processing something, a bacteria or a virus, but the fever is a healthy response. It's a good response. You don't want to get rid of your fever necessarily because that's what's your body's innate intelligence at killing off whatever it is that you're infected with. So symptoms can be bad, symptoms can be good. You can't judge your health by symptoms.
Yeah, that's a really good point because if you take a step back and think about what a fever is doing, it is increasing your temperature to get rid of a problem. Right. If you're looking at that as the only like, what's the word? The only, I guess we're going to go with symptom. If that's the only symptom that you're judging by, like, what was the step back before you got the fever? Like, what caused that? And people don't really take the time to think about that because they're just thinking about the here and now, not the what happened and what is going to happen.
And it's interesting you just said that too, about what's the step before the fever. We talk about this invisible enemy, this germ that's out there that's going to get us. And you always just have to think of it this way: no matter what it is, no matter what, a germ, a virus, a bacteria, a germ is opportunistic. Opportunistic means that nothing's going to happen unless there's fertile soil for that to grow in. It's just like if you had some seeds, some plant, some vegetable seeds in a little pack. They come in those little packs, right, at the hardware store, but they never grow in the pack. Did you ever notice that? They still stay as seeds. The only reason they grow is once you plant them and you give them fertile soil and water and nutrients and light and heat and all that stuff. So you have to make the conditions proper for them to grow. It's the same thing as germs. Germs are opportunistic, kind of like whenever you see some roadkill, and if you look at it closely, if it's been there for a few days, there's usually maggots in the roadkill, right? So it's not the maggots that cause the roadkill, is it? Or if you have some, let's say you have your wheelbarrow at home and it's filled with rainwater and it sits there for a couple of days or maybe even a couple of weeks because you haven't done anything with it. And then you get all these mosquitoes that swarm in there and they start laying eggs in the water. It's not the mosquitoes that cause the water to become stagnant, is it? Right? So even the raccoons, raccoons come to where you have garbage in your garbage pails. But if there's no garbage in the pail, the raccoons don't come. But the raccoons don't cause the garbage. So we look at opportunistic as germs are opportunistic. That's more reason. That's the reason why you want to make sure you're as healthy as possible from the inside out. You can't get immunity from the outside in unless you're making a natural immunity by being exposed to something and your body is functioning normally and it creates antibodies. That's pretty much how it works, and it's a very sketchy, ambiguous subject out there right now, and nobody talks about the germ theory. That's just the germ theory, that germs cause disease, as opposed to being opportunistic and germs function well in fertile soil. Just don't become the soil.
I think that there should be more people talking about these kinds of theories and issues. Maybe not theory. Theory has a bad connotation, but just explaining to people how these kinds of things happen. Because when you go to like the normal write you a prescription doctor, they'll just tell you, okay, this is going to solve it. They don't explain all of the time all of the this is how it got here. This is, well, maybe theoretically how it got here, but all of the steps so that someone fully understands what's happening. Like you just explain the germ theory, and I'm sitting here like, oh wow, like I wish that they explained this in like science in high school or something, so people can understand like and make that inference. Because like, I'm not saying that some medical professional needs to come out here and give everyone a lecture on germ theory, because no one's going to tune into that lecture. Well, there's some people who will, but like the average person that needs that information. Whereas if it was incorporated more as in education growing up, I feel like more people would understand that and maybe not be as scared right now as they are, because they understand how this is physically working.
Well, look, some people have a legitimate concern for being scared because if they have an underlying health condition, they have a weak immune system. Yeah, this is very scary. But it's too late to go back and say, well, why did you get that way in the first place? Sometimes you can't help it. Sometimes just shit happens in your life and you got dealt a deck of cards and then that's what you got. So you got to mitigate the best way you can. But I'm just talking about as far as a theory in principle that explains why some people can get sick in a family and other people don't. I know friends, I know people who have gotten sick with COVID-19, but the rest of their family didn't. So how do you explain that? That's, it's because their body just resisted it, or their body was able to fight it off. I mean, that's it. It's not like there aren't people out there with bad immune systems or that are underlying health conditions. They should be scared. It is very scary. But on the other hand, let's look at what we can do to move past this and build our immune system the best you can. You might have a limitation of matter. You might have a heart condition. You might have an issue where you can only be as immune as possible, but still it doesn't discount the fact that you can do things and still enhance your immunity from natural ways from the inside out. You can still do that. Your immune system is just not going to be as great as it might be if you didn't have that underlying condition. That's all. That makes sense.
It does make sense. And I'm so glad that we were able to have you like explain that, because hearing that makes me feel a lot more comfortable. Like I've also heard of people who, like, two of my friends who are in quarantine together, a boyfriend and girlfriend got COVID, but the parents didn't. So it's very interesting to hear, like, basically like taking that lens and zooming out to the big picture and kind of thinking on more of like a scientific level rather than, hey, this is coming at us, this is what's happening now, like I'm going to get this, like just keeping in that small center of focus.
Right.
I'm using camera analogies, but
I mean, and I want to knock on some wood when I say this, maybe, okay, but just to say that the interesting thing is that, and I'm not making any claims, but according to what I'm seeing in chiropractic practice so far, it seems like none of the people that are coming in here have gotten sick with this yet. Now, there are a couple people I know that have had it, and they are practice members, but they had it before they were coming. It was like they weren't in the office when they got exposed to it, and then they got over it, and they got rid of it. So they weren't even part of the practice at that moment in time. But for most of the practice members that are coming in, that are the people that I've been seeing, everybody's been staying healthy, which is a great thing, thank God. So I don't know what I'm saying by that. I'm just saying that's just one thing I noticed. So I think that's pretty cool. So.
Yeah, it's a cool observation. And I know that you have people of all different ages that come into your office. Obviously, I'm in my 20s. I know I always forget his name, but the guy with the red hair that brings his whole family with him, like the little baby and everything. Like, yeah. I see all these people, and then I also see you treating like the elderly population. So the fact that you've noticed that the people that are still coming in are all in good health is very reassuring.
Right.
For at least me, who comes in to get my neck adjusted, to get my back adjusted so that I can continue being healthy.
Right. Now, just so you know, some specifics that came down the pike recently, and this is something I hate having to say this, but they're constantly trying to make things better in the state, so they're limiting what we can do as chiropractors as far as who we can see. So we are still taking care of essential healthcare workers and anybody with emergencies, chiropractic emergencies. And a chiropractic emergency can be anywhere from somebody who has an extreme level of pain, perhaps on a 10 scale, they might be even a 5 or more, or they've had chiropractic care and they've stopped and they realize that with the their body regresses to a point where it's where they can't function, and then they need to continue their care to keep functioning well, because they know that if they stop, they'll have a serious regression that can be very detrimental to their health. So those are the people that we're seeing now, which is a lot of people, unfortunately, but fortunately.
And what's the experience that they're having at your office, like in terms of like what's the rundown with all of the precautions that you're taking?
Yeah. So like, what's the plan now? People come to the parking lot. They got to call us from the parking lot, and then Katie at the front desk, she triages everyone, makes sure that they don't have any symptoms of COVID-19. They haven't been out of the country. Obviously, nobody's traveling right now. And most people aren't going to come here with symptoms anyway. They're just hunkering down if they have a symptom, because everybody's freaked out. But some people have allergies and they might have some symptoms, but we go through that list, make sure they don't have anything that's COVID-19 related according to the CDC. And then when they come in, we're only allowing, we have space to fit 4 people in the adjusting area. We have 3 adjusting tables and 1 chair that's off to the side. Everything is spread out greater than 6 feet. So we're keeping to the 6-foot rule. We're letting them in one at a time, and then they can go into the adjusting area. I'm wearing a surgical mask when I adjust people, when I'm interacting with patients, because I'm just trying to prevent anything coming out of me, so I'm not transmitting anything to anybody. I might be a carrier, and I'm perfectly healthy, but you don't know. So that's what I'm doing here to make everybody feel comfortable. People can come in with or without a mask. It's up to their comfort level, but I know I'm wearing one myself. We have everything sprayed down with alcohol. and with the Lysol, and we clean before and after each shift. We spray between each patient. We spray the tables, spray hand rests, anything that they touch. There's no sign-in process. Katie signs everybody in, so you don't have to touch anything, no clipboards or anything like that when you come in, or pens. And that's it. People feel very comfortable. They want to come in, they want to get their adjustment. People are sticking with their care plans, and getting the results that they want to get, staying healthy.
Yeah, I can definitely attest to the comfort of going in there, because like I said, I get bad headaches. I went in for my adjustment. Everything's super clean. I'm just backing you up, Dr. Mike. And it felt like a safe place. Like, I know when I was leaving my house, I had a weird moment where I was holding my keys, staring at my front door, and I was like, am I going to get locked out of my house? Am I going to be able to get back? Am I going to get stuck out into the middle of nowhere? Like, I know everyone has like that stigma of like, I should be home, but you need to keep in mind also that you need to take care of yourself. And if that means chiropractic, or like just taking care of your body, going to that doctor's appointment, you have to just keep that in mind as part of taking care of yourself.
Yeah. I mean, in these times, in these days, in this age right now, with what's happening, I can't see a greater need for people to get stress mitigation. And if it's through the adjustment, amen, because we're not adding drugs, we're not doing surgery for sure. And if people can get a reduction in their stress level, and they can help get rid of, I mean, people are working from home. They're sitting in a cramped position on their bed, on their laptop, and their backs are killing them. So just for the mere sake of getting rid of the pain so you can do your job at home, it's great. Come on in, get adjusted.
And this is a positive way to cope, because I know that there also are people that are self-medicating with other substances, but this is coming in, getting that relaxation from a positive source, and also working on your health rather than, getting an extra bottle of wine or something like that, which
sounds nice. No, I get you. Yeah, and just another things too is on my YouTube channel, I added a couple of videos. I keep trying to put out content for those people who just don't want to go out. They just don't want to go out, and that's cool too. They want to stay home, and they can't come get adjusted. They just don't want to do it. Then I put some videos to at least help them. I can't adjust you through the TV screen, through the computer, but at least some tips that you can do for mitigating a headache if you're at home. Rolling out your back, your low back, some stretches, just things to help. Yeah. So I'll populate some content with that too, and check that out on the YouTube channel. Kings Park Chiropractic, little plug there.
Yeah, we'll also have you review everywhere that they can find you at the very end. I have one or two more questions. Since we're not a TV show, as long as you're able to stay a couple extra minutes, then we can go as long as we want.
Whether people listen.
I mean, we have people listening. I checked all the stats from your page. We've reached over 600 newsfeeds. Mine, we've reached over 400. So it's probably changed by now, but people are definitely coming through. But I was wondering, are you seeing any new patients right now? Because I know you have your X-ray machine and everything. If there are essential workers that are having a problem, are you still doing that, or is it more so just the recurring people at this point?
100%. Yeah, definitely. You know what? I've absolutely. Yeah, we're seeing new patients. Of course, we have to, because people need the care, and there are people who are working really tough jobs to keep things going, and people who are in these essential working positions are working longer hours, and some of them are doing even split shifts where they'll go in for a longer amount of time, but then take a day or two off, and then go in for a longer amount of time because the actual place they work at wants to cut the volume of people that are there at the same time in half. So these split shifts are sometimes night shifts one week, day shifts another week. That's really strenuous on the sleep schedule, on your cardiovascular system. Other people are just stressed out because they're working 2 or 3 shifts just to get the work done. And they need chiropractic care. Absolutely. I'm totally here for them. Yeah, nothing as far as that has changed. Like I said, we have all the mitigating factors in place. So it's a safe place to come in. I would just say call before you come in. That's all. And then we'll make sure that we have a safe place here for you.
Yeah, and just for a recap for people that aren't familiar with your practice, you have the X-ray machine there. You have all of the things that you need within the one building, so they wouldn't have to run around to go get their stuff done, their radiography done elsewhere. You would be able to take care of them at your location.
Right, and we have it's a digital X-ray machine too, so I don't have to wait for films to develop. Sometimes what I will do though is if I'm taking certain films that require what I call a motion study, or if I have you do a flexion extension of a certain part of your body to check, there's an analysis that needs to be done on that, and it can take some time. So sometimes I'll have a person come back, and then we'll review that a little bit later in the day, or even the next day possibly, just so it's keeping the flow of the office going. But at least I have a chance to look and study those things before we start doing adjustments. But anybody who comes in who's a new patient, we'll check you. We'll do the exam. We'll do a detailed history. We do whatever's necessary as far as X-ray is concerned, and then we go over all of it, all the findings. You got to see it just like I see it. You know, you're a part of this just like I am, 50-50. You know, we're in this together. So it's really important. It's my philosophy that people really get an idea and they understand what's the problem, how do we correct it, and what's the plan? How do we attack this thing, and how do we help you get better? So you're a part of that process. I'm not just one of those people that, you know, a doc that looks at an X-ray and then I just tell you what you need to do. You know, it's all up to you. You're the consumer, but you should be as informed as possible. And I'm really big on you being as informed as possible. Any questions, bring them on. I love that.
I also like how you also give homework. If you have lower body issues, then he's going to give you homework that can help relieve some of that from home. And same with neck issues. Like I have my foam roller right there, so that I can help try and get the arch back in my neck, because my neck basically looks like this.
Right. Well, who's ultimately responsible for your spine and the condition of your spine? Right. So if I give you some things to do at home and you don't do them, how does that affect me?
It doesn't, but it just hurts me to look at the foam roller and say, "Oh, I missed it today."
There you go. Yeah. So like, I'm going to give you home care because you need to be responsible. Too many people in the paradigm of healthcare always put their healthcare in somebody else's responsibility. You know, I'm sick. Go to the doc. You take care of me. You fix me. And then I can go back to doing the same things I was doing before that got me in this mess in the first place. No responsibility. That's not the way it works. It's not the way it should work, unfortunately. So you got to be responsible for your health. You're the only one who can answer to yourself about that. And, you know, I'll give you the stuff you need to do, and I'll be your partner, your teammate. But, and I can do the adjustment because you can't do that yourself. But the other stuff, you know, you're responsible for bringing yourself into the office to get adjusted. Many people don't follow their care plans. They don't come in when they're supposed to. And then they say, "Doc, it still hurts. It's still bothering me." Hey, did you make it here the way you're supposed to be here? You know, this is the recommendation. I'm going to give you my best recommendation. Whether you follow it or not is up to you. That's the way I look at it.
I'm holding this and I feel guilty because I haven't done it in a few days, and I'm just going to leave this on the desk so that I do it afterwards. But yeah, one question that it didn't really fit into a lot of the other like parts of our discussion, but I think it fits in now, that I wanted to ask because I wanted your opinion on it, and I won't keep you on too long. But what about the people that are self-adjusting their necks or doing that at home? Like that is exactly the reaction that I thought. But can you just like explain why people should not be doing that? Because like I'm guilty. Like every so often I'll be like, "Oh, something feels a little weird," but what is the actual repercussion of doing that?
Okay, it's kind of it's a good question. It's multifaceted. Let's start with figuring out. See, I'm the principles of chiropractic are based on one thing: that your body has an innate intelligence that knows how to control and coordinate all the functions and the healing in your body. And the distribution of that innate intelligence is through the nerve system. And we can't have any interference in the distribution of your body's inborn wisdom to heal itself. That's the principle. So now, if you've got this feeling that you got to crack your neck and you got to, and people go like this and they want to wrench their head with their, you know, they have that feeling. it's still an innate feeling. It's an innate feeling that says there's something wrong and you need to move it. Your body is telling you, you need to adjust something. There's something subluxated. There's nerve pressure. There's something going on in it, right? Okay. So that's the reason why people have that feeling. Second thing is when you have a joint that pops in your spine, it's not bone rubbing on bone. What it is it's actual waste products. It's gas. It's nitrogenous waste. It's carbon dioxide, things from cellular metabolism in the joint that get released. In the process of that joint popping, it's kind of like when you pop your knuckles or you do that, it's the same exact joint in your spine, the same movable joint. In the process of that, you definitely release an endorphin, which makes you feel really good. Okay, so you could pop your neck and go, oh, I feel so much better. Okay, this is why we don't just judge your health by how you feel. You want to look at the x-ray, you want to look at the structure, you want to do before and after x-ray, you want to make sure you're getting your spine managed with chiropractic so that you know you're getting better, not just feeling better. You have the innate feeling that you need to pop something, you pop it, it feels great. Now the question is, did you actually do anything to correct anything? Did you remove a subluxation? If I ask anybody who does this, I could say, which vertebrae did you contact? Which one was the subluxated one? And then you'll hear crickets, and then they say, I don't even know what a subluxation is. Okay, then what are you doing to your neck? Well, I'm just popping it. Which one are you popping? You know how many joints you have? You know how many bones you have in your neck? I don't know. Well, then why are you doing that to something that's protecting your central nerve system, something that's so important and so delicate, and you're just going to wrench it? So doing a lot of damage, number one. Number two, no specificity. You don't know what you're doing or where you're popping or what direction. When we look at an x-ray, we can see, we can analyze what we call a listing. A listing is, if you look at a spine model, okay, you'll have different landmarks on the spine. You'll have spinous process, you'll have lamina-pedicle junction, different listings or different parts of that. And how a vertebrae shifts out of alignment based on the film on the x-ray and based on the palpation findings can determine what direction you need it to be moved in. If you're just grabbing your head and wrenching your neck, you're not being very specific at what you're doing. So then you could be damaging more of the discs in the healthy areas than in the parts that need the correction. So now you could be doing more damage. Okay, so you don't have a listing. You don't know which one you're contacting. Should I go on? And then the other thing is, when you're talking about, let's say, let's just take your neck, for example. When you have 7 different vertebrae in your neck, there are 4 joints, or there are 4 articulations on each vertebrae, plus movable articulations. And then you've got those connecting with those below and below and below. So there's lots of articulations, lots of movable joints, all right? If there's one that's locked up and that's stuck, and that's part of the subluxation complex at that area, you're going to have joints above it or below it that are going to move more to make up for that one being stuck. So what happens? Now this one's stuck, the one above it is going to move more. It's called hypermobility. The hypermobility with extra movement is going to wear out that joint faster. Okay, but when you go like this and you go like this, or whatever you're doing, and you're not contacting and adjusting the stuck vertebrae, the ones that move first are going to be activated. The hypermobile joints are going to be moving. And when those hypermobile joints are being moved more manually by your own self, you're going to even wear them out faster and cause more damage, more disc problems. You're not doing anything to correct the curvature in your spine. You're probably ruining that too. And you're setting yourself up for failure. Don't crack your own neck.
So basically, have a professional look at your neck instead of you doing it, or like having someone just like do the adjustment like this on your back, because
yes, don't try this at home.
You adjust it incorrectly and then you can hurt yourself.
Yeah, I mean, you're not, look, we spend years at school, at chiropractic school. Look, the adjustment looks really easy, and it can be very easy, to do an adjustment. The hard part is knowing when to adjust and when not to, because you can have a patient who feels pain or a person who feels pain, and they say, just crack me, and then if you go and you give them a hug and you crack them, they might feel better. You might have gotten lucky. You might have reduced some nerve interference. You might have only just stimulated an endorphin release, but you got to know when not to adjust. And that's when we do a specific analysis, and we want to be as specific as possible so we know exactly how that vertebrae has shifted so we can better restore that function in that person's body. you could be causing more malfunctions in the long run if you're not doing things properly.
So, Dr. Mike, we're coming up to a little over an hour, so I'm gonna cut this conversation a little short. But I would love to have you back for more discussions on maybe like we can do a topic video about something in the future.
Sure.
But do you have any final thoughts that you think would be great for the audience to hear at this time? Maybe if they tuned in late or are watching this back before we hop off.
Final thoughts. There's a lot of curiosity and misinformation about chiropractic. A lot of videos circulate with these guys cracking and crunching people, which are so fun to watch. But I would say that honestly, there's one inherent principle of chiropractic, and that is to remove interference to your central nervous system to restore the normal function of your body. Simple. Okay. So I'm not treating the cause. I'm not treating the pain. I'm not treating the symptoms. I'm removing a potential cause of that by doing the adjustment. But the power that made your body heals your body. Be careful what you see on YouTube as far as information. There's lots of things that you'll read that are good, just things that you'll read that are bad, but the best thing is to consult with someone, a chiropractor, for your own specific case and your own specific issue. Make sure it makes sense. It's got to make sense. It's got to make sense to you. Don't just do things because somebody tells you to do them. Get the film, get the x-ray. If you need that, get it, look at it, ask the questions, make sure it makes sense to you. Make sure you're a partner in your healthcare. It's the best thing you could be is an informed consumer of your own healthcare. And the more information you get, the better it is.
I feel like that's so important to stress. So if you guys have any questions or anything, maybe you guys can reach out to your local chiropractor, or you can reach out to Dr. Mike. If you're on Long Island, he's over in Kings Park. If people do want to get a hold of you, where can they follow you? Where can they reach out? What is the best way to get a hold of Dr. Mike?
Best way to get a hold of me is to call me or text me. I have a cell phone. It's 631-663. Wait. That's my office, 631-742-1211. It's my cell. Or you just go to the website and there's an inquiry page. The website is kingsparkchiro.com, kingsparkchiro.com. We also have a YouTube channel, Kings Park Chiropractic YouTube, and Facebook page. So there's lots of social media out there. You can contact me on any of those methods. That's pretty much it, I think though, just the most important, I'm just thinking as I'm saying these things before, is that ask questions. Always ask questions, no matter what. Ask questions about anything that you're being told. Things that you're being told by the governor, things that you hear on TV, things that you hear on Fox News, things you hear on CNN, whatever it is, ask your own questions to yourself. I'm like a huge question asker, and I'm constantly got my nose buried in my phone on Google. And I'm always looking things up because things don't make sense to me. One of the things I was asking was about PPE and personal protective equipment. And I'm asking myself, how much protection does this really offer me? I don't really know. So I'm like, how big is a virus particle? So I look up how big it is. And I go, well, what's the actual scientific evidence of the N95 and what it can filter out? What's the smallest particle it can filter? So I'm asking myself these questions just to give myself information so that I can answer that, or at least it makes sense to me. When it comes to your healthcare, ask questions to yourself, on Google, to me, to anybody who that can give you some kind of an answer. Ask your neighbor what their opinion is, but just bring the information and formulate your own opinion. Don't just go by what other people say.
That's actually very important, especially in the time of Facebook news feeds. Make sure that you're asking the right questions and looking for the correct place to get the right answer. So thank you so much for throwing that in at the end, because I think that's very important as well. Yep. So Dr. Mike, thank you so much for coming on today and enlightening us and giving us a little insight of both just more so like chiropractic, but also like giving us the information about like the germ theory and all of those different things that people may not have that in their heads right now. So you had a lot of amazing things to say. So I'm just so thankful that you were able to come on today.
appreciate it. Thank you. I appreciate you having me on.
No problem. Of course. When I first started making the live stream thing, I was like, wait, I have to get Dr. Mike to talk. So I'm not going to hold you too much longer, but if people want to get a hold of you, definitely get a hold of Dr. Mike, and I will see you for my adjustment in the near future.
Great. Yeah, just text me. That's easier. Right.
Yeah.
Perfect.
All right.
See you soon for your adjustment.
See you soon. I'm gonna pull you off of here, but I will catch up with you in a little while.
Thanks, Celia.
All right. Thank you so much to everyone that joined us in the comments in the live stream. If you are looking to watch this back and either re-listen to or learn about a little bit more of what we spoke about today, the live is going to be on Dr. Mike's Facebook, which is Kings Park Chiropractic, my Facebook, both of our YouTube channels. You can also listen to this as a podcast on SoundCloud or Apple Podcasts. So if you guys are more curious about some of the other topics that we've been discussing on here as well, we've had a couple of different holistic health professionals on. We've had trainers on. We've had all sorts of different professionals. You can follow my page, Celia Werner Productions, and look through some of our lives. And we are doing these broadcasts daily. So if you guys want to join in and find out a little bit more about how different industries are handling coronavirus or just interesting topics like Broadway or, video games like we did on Saturday, tune in and we're going to have a lot more interesting people come and discuss. So thanks again for watching, and I hope to see you guys on the next episode.